ABCs of Health Insurance, brought to you by the University of Virginia Department of Student Health. Do you know what is health insurance and how does it work? It can be a lifesaver, literally, but how do you choose the one best suited to your needs? Health insurance helps you pay for the services of medical professionals, like your primary care provider or a specialist, and it also helps you pay for medications, hospital care, and special medical equipment when you're sick or injured. Health insurance will include some services without paying the deductible or co-insurance when you receive services at an in-network provider, like immunizations for children and adults. Hey, it's better to prevent a highly contagious and possibly deadly illness than to deal with the consequences of it, or even with an epidemic. Yearly visits for women, obesity and tobacco use screening, screening for depression, sexually transmitted infections, and more. In other words, health insurance is useful even when you're not sick by helping you stay healthy. For more information about preventative care services, visit www.healthcare.gov. Health insurance can be for you or for your spouse and family members too. In that case, they are the dependents. Like with any insurance, you or your employer need to pay a premium for your health insurance or plan. It's paid monthly, quarterly, or yearly, whether you are using medical services at the moment or not. If you don't pay it, you can lose the coverage. In return for the regular payment of the premium, when you or your family members need medical assistance, insurance will pay for a portion of the medical costs. Please keep in mind that the insurance typically pays for a portion, not for the entire cost, unless you've paid your annual total out-of-pocket maximum. It will be up to you to pay for the remainder, be it through a deductible, co-insurance, or co-payment. So what do these words mean? A deductible is an amount you will have to pay out of your pocket for the medical services that your health plan covers before your insurance begins to pay its portion. For example, if your deductible is $1,000, your insurance will not pay for covered medical service until you paid for $1,000 towards your health care. The services that your insurance doesn't cover don't count as a part of the deductible. Typically, the lower the deductible, the higher the premium. Once you have met the deductible, you may have to pay copays and co-insurance. Both the co-insurance and the co-payment are your share of the costs of a covered health service, like a medication, a visit to the doctor, or emergency care. The difference is that the co-insurance is calculated as a percent. For example, if your percentage of the co-insurance is 20% and your visit to the doctor is $100, you will pay $20, and the insurance will cover the rest if you have paid your annual deductible. While the copayment is a flat amount that can range between $10 to $50 or higher, depending on your insurance plan and the medical service that you need. Another thing to keep in mind when choosing your insurance company is the network. A network means the facilities, health providers, and suppliers that have a contract with the insurance carrier. Visiting in-network providers will cost you less than seeing out-of-network providers, and some insurance companies will not cover the expenses for out-of-network providers at all. Networks can change too, so check with your health service provider every time you make an appointment to avoid unpleasant surprises. In short, when choosing a health insurance company, here are a few things that you should pay close attention to. The insurance carrier's network, which hospitals, doctors, and pharmacists are in it. The deductible and the premium. Are you comfortable with both? The co-insurance and the co-payment. Can you afford them? And what does the plan cover regarding medical services and prescription drugs? Choose wisely, and you will keep both yourself and your family as safe and healthy as possible.